No problem at all.
Thank you so much. Good evening, everyone. Thank you very much for joining us this evening. It's lovely to see everyone nice and early. We're starting now. Today, we are talking about menopause. Lots of us experience it. Lots of us haven't experienced it yet. So it's an opportunity to learn about how to deal with the situation. I am not in menopause yet, even though I'm 44, but I will definitely be learning a lot today about menopause. It's a very interesting topic, and I think we all need to know about it. So thank you so much for joining us this evening. Today we are with our very lovely guests, Dr. Zoe and also Jose from Nano Minerals. They will be telling us about menopause and how we can manage our symptoms. If you would like to contact me, my contact details are gloryedward21@gmail.com. My Instagram page is Glory Edward Nutrition, Glory Edward Organic, and Chef Imani's Kitchen. And also gloryedwardorganic.com is my website. If you want to get any of the Nano products today, you can order them from our website, vivonutrients.com, and also gloryedwardorganic.com. You can order from there. And if anyone would like to book an appointment or to speak to me or ask me any questions, you can also do that as well. I have also got a Telegram page. I've set up a Telegram coaching group where I put information about menopause, all the different things that you have, how you can manage it, the foods that you can eat. They are all in the Telegram group. I will obviously be sharing the information after this message so that you can join the group. It's a public group, so you can find it. Services that Glory Edward Nutrition offers: our body MOT bioscan. We do health consultations. We do essential oils, massage and sleep oils, organic herbs and spices, skin and hair care range. We also offer detox program for anyone that would like to lose some weight. We do food intolerance scan. We also do workshops and seminars about different topics that affect women's health and also health generally. We do meal plans, we do ready meals, cooking classes, nutrition coaching, and also food for wellness scan that tells you the food that your body is actually requiring. And every Saturday we do what we call pain clinics. So if anyone has pain, you can come to us and we will sort you out on a Saturday. But on Saturday, I'm open from 2:30 to 7 p.m. on Saturday, but Monday to Friday, I'm open from 10 to 5 p.m. Thank you very much. So next week, we will be talking, we'll be doing a question and answer session on lung inflammation. And in September, we will be doing sugar, and also we'll be doing a sugar challenge. And also we will be talking about sugar and inflammation.
Well done, Princess Glory. This is very important. I urge people to listen to this.
Yeah, cool. Thank you so much. So now I'm going to introduce Dr. Zoe, and then we're going to start.
Amazing.
Thank you very much. So thank you very much, Dr. Zoe, for joining us. Dr. Zoe is a clinical nutritionist and integrated doctor and a consultant for Noble Naturals who received her training in King's College London in conjunction with King's College London Teaching Hospital at Denmark Hill, Oxford University in conjunction with the Radcliffe Infirmary. She has personally conducted major studies on thousands of subjects, investigated cancer, disorders, cardiovascular disease. Much of her investigation work has been part of the Europe Prospective Investigation in Cancer and Nutrition, Oxford. Dr. Zoe has also got 22 years experience in her own practice, focusing on naturopathic approach to nutrition therapy, working mainly through developing her patients' understanding and awareness of normal food and how food can be used as medicine to promote their health and also all levels, thereby providing them with lifelong nutrition-based means for healthcare. Again, I'm so happy to know that Dr. Zoe actually focusing on food, because that's obviously one of my passion, like talking about food, how food can help. So every time people come to me, I'm always saying, you know what, you need to eat the right food. You're not eating the right thing. That's the reason why you're having these issues. So thank Thank you, Dr. Zoe, for joining us this evening. Would you like to say anything before I ask you my first question?
No, absolutely no. It's perfect. Please ask your questions. It's wonderful. Thank you for inviting us. We're very honored to be here, and we will do our very best to. I really want to educate people, and I thought it was extraordinary what you said about sugar, because my greatest. I go on and on about how, with the menopause, with everything, the greatest problem that we have in our society is the consumption of sugar. And when you scan a brain of an individual who has consumed cocaine and has consumed sugar, they look identical. So I'll leave people with that to tell you how addictive sugar is, and the terrible causes it does with disease. I could go on for 10 hours and not say enough. So I'm really glad you're doing such a talk. Well done. Well done. It's very important. Very important. Yes. And important for menopause. So that's why I segue into it, because it's vital.
Thank you so much. Dr. Zoe is here with Jose this evening. So obviously Jose is going to be supporting Dr. Zoe in all the stuff that she's doing with us this evening. Thank you so much, Jose, for joining us this evening. God bless you.
Thank you.
Thank you very much. We appreciate you. And thank you for making it possible. I appreciate that. Thank you so much. God bless you. So my first question to Dr. Zoe this evening is, what is menopause?
Well, menopause is, I don't like to use the word end. It's the start of a new transition for woman in her menstrual cycle. And it's a term that has been coined from the Greek to describe the changes that we go through before or after we have our periods. And it basically signifies the end of our years, although women have fallen pregnant during menopause when their periods are finished, but it does signify the end of our reproductive years as far as children are concerned. But we know now that actually it's a new beginning for women in many, many ways. So it's termed as the making of the end of the reproductive years in medicine, but we all know that it's much more than that. But that is what it signifies.
Oh, thank you so much for explaining that.
Can I just say the cause? Sorry. Shall I just say why it happens?
Yes.
Shall I say why it happens?
Mm-hmm.
Basically, we are born with eggs. Now, our eggs can be increased and decreased, although they say it can't, it can. But what we can do is, with our lifestyle and changes, we can preserve our eggs, but they are stored in our ovaries. And the two main hormones, there are many, but estrogen and progesterone control our menstruation and our ovulation and the release of these eggs. So menopause happens when the ovaries can no longer release an egg every month and menstruation stops. It happens to every woman, but it can be brought upon sooner if a woman has had either surgery, and often that is hysterectomy, or a damage to the ovaries, which can happen with an accident, with terrible trauma, menstruation. We must always include the trauma. We must always include the psychological aspects of who we are, and also chemotherapy. I've seen in many women that have taken chemotherapy, they can go into menopause early. Sometimes they can go temporarily, but depending on the chemotherapy that they are experiencing, they can go into menopause. And many symptoms, the first symptoms that a woman begins to feel is a tiredness. Often women will talk about a sort of a flowing, it's called a flowing depression, where it comes and goes and comes and goes, and they lose confidence. But most common, they'll have hot flushing, blushing, sweating, uneven periods, a vaginal dryness or a dryness in the vagina that takes longer. Welcome to all the lovely men. We're going to talk about it. We're all here. Welcome to you all. We've all got to swallow it. Men go into menopause as well, and I can go into that, talk about that as well. But often a dryness, and usually trouble sleeping, anxiety, past thoughts that haven't been dealt with come back. You know you're going into menopause. My patients would say, emotional changes, dry skin, eyes, dry mouth, and often sore breasts is a clue to menopause.
Wow.
And yes, but often a racing heart and often a change in the libido. And what I mean by that is it's just an entire change the way a woman sees her body and how she sees herself. But sometimes during menopause, I've had patients where they find they rediscover their libido because they're not worried about pregnancy. So, and they often have a wonderful time. So there's everything in between, but generally, it's a change in the libido. Hair loss, weight gain, controlling weight is huge. And what happens during menopause? We have phases, 3 phases. We have peri-menopause, which is a phase that begins several years before, and the ovaries are slowly making more estrogen and progesterone, and it can last years before menopause takes effect, up to 5 to 2 years before. But many women will still experience menopausal symptoms. Then you go into menopause, where as we've said, your ovaries stop releasing eggs and making estrogen. Then we have post-menopause, where you can have hot flushes, anxiety, tension. You feel your skin, as we said, dry vagina. So they're the 3 phases. So I hope I've clarified. I could go into that more, but I know you have lots of questions. Oh, I'm admitting people in. That's okay, Princess Glory, isn't it? That's what we want to do, isn't it? Yes.
Thank you, Dr. Zoe. The next question is, what is induced menopause?
Well, often this happens when a woman has her ovaries or her removed, or it's usually endometriosis and entering cancer, and it happens when you have radiation and chemotherapy drugs. But I just want to say a bit more about that because it's extremely important, and it happens a lot to many women. And induced menopause is, it sort of describes when menopause is caused by medical intervention or an accident. Sometimes a woman, I had a woman that had a serious car accident and all her womb was severely damaged. I had another woman when I dealt with women who had come from countries, war zones, etc. Through horrific trauma, they went into menopause almost immediately. But certain drugs and radiation can increase menopause and bring you into menopause. Of course, a hysterectomy. But so surgical menopause, or when menopause it can occur abruptly after a trauma or after surgery, which happened to me after a trauma. I was perimenopausal and I immediately went into trauma. So an abrupt loss of ovarian hormones, and often this can happen when a woman has a shock. I've seen women go into menopause when they have lost a child or a mother or a husband. You know, you see it happens almost immediately. And so it is what we would call induced through medical intervention or through trauma.
Thank you, Dr. Zoe. Oh, I'm sorry.
No, Jose, please speak. No, please, Jose, please. Yeah. That's induced.
I wanted to address something. Obviously, women have endured menopausal symptoms throughout millennia. However, I think that nowadays women confront a more complicated panorama. So what are those, in your opinion, those factors
yes,
in nowadays that actually make menopause more complicated or even more difficult to endure, and sometimes even more dangerous. Would you?
Thank you. Sorry, thank you, my brother. And I'm going to put it over to you because EMF is a big one. Electromagnetic, it is absolutely, medical studies are beginning to show not only, and the main reason that it affects menopause, EMF, and then I'll put it over to Jose because he knows more than me, but for menopause is because it affects the brain. And what happens is that you get a leaky brain. And once you affect the brain, once you affect the pineal gland, once you affect these glands, menopause will happen more rapidly, quicker, and you will have worse symptoms. But Jose, you know a lot more about EMF. I know you've studied it extensively and you did a very good talk. So, but
yes.
For the brain, it is very important.
Yes, so I'd say that EMF is a big factor on worsening the symptoms of EMF of menopause, because you will find that the problem is with EMF that is ubiquitous, so it's everywhere.
Yes.
And one of the things that EMF does to the brain is that it alters the ability of the brain to go into a deep REM cycle of sleep, which is what a brain needs in order to detoxify. But not only that, if you have on top of that, you have lack of sleep as one of the symptoms of menopause, then you have a compound problem. So, which means that you're really not sleeping, you're not getting any good sleep for two important causes. This to me is pivotal, because if you're not able to sleep, your health will deteriorate rather rapidly. Even without you noticing it, you will find out that you don't have any energy at all, that your mood actually changes. You end up having something like a leaky brain.
Mm-hmm.
And for those that don't know what leaky brain is, I can just briefly describe it as is the invasion of toxins
Yes.
in the brain
Yes.
that negatively alter the functioning of the brain, but also is the inability of the brain to be able to get rid of such toxins. So it's a compound effect because of EMF. And if we add to that, and I'm just going through the worst scenario here. It's necessary that we understand the complexity of this in modern times. Then you have something like long COVID or simply COVID. Yes. You will find out, and Dr. ZOUE can tell you more about this,
yes,
that previous illnesses that this person had controlled in the past that were in remission will come up again.
That's right.
So you will have a menopause that is not going to be simply a regular menopause that our grandmothers had. This is going to be a menopause that is compounded by the exposure, the constant exposure to EMFs, but also to the virus. This particular virus that is very nasty, and you will find lots of complications. So I've seen clients that in the past they would say, yes, I've had headaches or lack of sleep. I also have loss of energy. But what I'm finding now is that is even more. Yeah. And they go into depression. This is the thing. They go into depression. They don't know what's going on. Now, the reason why I'm asking you this, Dr. ZOUE, and it's an open conversation, of course, between the three of us. And, yes. And when we ask questions, yes, as well, anybody can give their grain of salt, mm-hmm, is because we also have something that is new to combat or to try, yes, this new panorama with EMFs and with COVID compounding, yes, onto a natural process such as menopause. And I just wanted to open with that to see, yes, what are some of the solutions that a therapist like Princess could offer to their clients by the use of a new technology, which is contained in the nanominerals.
Yes, absolutely. That's pivotal. And we just did an incredible talk where we prepared a protocol for long COVID, and it's done so well. So we could always, Jose, pass that on to Princess Glory for her people to get that package, which is something that I know Jose is our consultant, and he specializes in helping practitioners. And working with you, Princess Glory, and all your practitioners would be incredible, because then you'd give them the very best and hone into them. May I also add that a lot of women that experience menopausal symptoms, the worst bit about it is that they get to a point, and it was a great medical paper in the BMJ where they looked at women working in the NHS. And what happened was these amazing women finally got to the pinnacle of their career, but their body was wanting to slow down. But they had worked their entire life for this. And their body was saying, please, please, you need to rest, which brings me to the next thing, stress. And many women get to the point where in their late 40s, early 50s, they have worked so hard to reach these amazing careers, and now their body wants to slow down, and often they continue or they mask it with masses of HRT and other things. And so this is something, this is such a big topic, Princess Glory. We're going to have to come back. So let's go on with the questions, and then we can go on to what I suggest as I go on with the questions with everything, because your questions will bring to light and tie in beautifully with what Jose has said.
Thank you. If I can ask everyone, please, to mute themselves. That's really important. Thank you.
Thank you, everyone. Because we get an echo when you're not muted. Princess Glory, more of your wonderful questions.
Thank you very much, Jose, for explaining to us about EMF. I didn't know that affects as well. And I also didn't know that COVID or long COVID also affects menopause as well. So that's very new to me. Thank you for sharing that information. And Dr. Zoe, thank you for explaining to us about induced menopause, because that's obviously new to me as well. I didn't really know about...
Princess Glory, just to add to it's so important that what they're finding, this amazing medical paper done across 5 teams that was sent to me before it was even published, women that are begin menopause, just peri, or have slight ME, multiple sclerosis, they might have sexually transmitted diseases. With long COVID, they are all coming back because the virus is living in the organs. So that is another talk on its own. But we can do something like that later with the long protocol. Jose will guide you. So just to tell people what you are offering people is extraordinary.
Thank you so much, Dr. Zoe. We didn't really know about long COVID. Lots of people don't know about long COVID. So can I just ask a question about COVID? I've had COVID a couple of times last year. I think I had it like 3 times. And I ended up in hospital for one of the situations.
I'm sorry.
So if somebody's had COVID, does that mean that it affects them generally? Does that mean that, lots of things come back? Do they have lots of pain? Do they have lots of problems with their lungs? And stuff like that?
Yes, they do. And some people, it's extraordinary what happens, and they still find the virus in their brain, and many people, irritable bowel syndrome. I did an extraordinary talk on it, and I'm happy to come back and present it to your group, Princess Glory, and all those questions. Don't you think, Jose?
Yes, definitely.
We would love to present it to your group. And I will present the medical facts and some lovely protocols, and you can work with Jose we will do that, because it's a whole topic, because I really want to get, I know how important the menopause topic is, and we can do part 1 and part 2, but if we could get, we could do part 1 and part 2. But they found it everywhere in this medical paper. 9 months after, people weren't able to see properly, people were still depressed. It was really extraordinary. This medical team between Harvard University, Oxford University, and another medical medical team in Israel. So this was a very extensive paper. It was 49 pages. So I'm happy to come back and discuss it.
Thank you so much, Dr. Zoe, for that. So what is postmenopause? We've talked about menopause, we've talked about induced, and now postmenopause.
Yes, postmenopause is the years after menopause, where you still have a little bit of unusual symptoms. You may still have hot flushes, and you're still having sporadic menopausal symptoms, but hopefully not as bad because you've dealt with it very well through, which we will discuss as well. I know we're keen, you, myself and Jose, to really discuss how people can transition through, and also they can have something for the rest of their life, where their bones are protected, their heart is protected, their eyes are protected, where everything is protected, which is what we're trying to do. You know, so people can transition into the next phase of their life and not have symptoms.
So thank you, Dr. Zoe, again for that. So what changes will I face as I approach menopause? So for those people that are just starting or trying to find that information, what are the things that I would notice or that makes me know that I'm entering menopause?
Yes, the most important ones, if they're not addressed correctly, is wrinkles, dryness, generally through the body. That's why we have to hydrate. That's why the nanos are amazing, because they contain structured water, and structured water is extraordinary. People experience heart problems. Osteoporosis is huge. Poor muscle tone, weaker vision, cataracts will tend to appear more, muscular degeneration, and there will be a lot of changes sexually. Women experience this sexually, and men. And some people, we're all adults here, may even experience a situation where they cannot reach an orgasm, etc. Things like that have shown up a lot in menopause, quite common. People used to come to me and talk about it. Also, it's very important to have our eyes tested when we go into menopause, because we have weaker vision, and cataracts can become worse. So they're the main ones. And weight, of course, as well. We have problems losing weight, and that's why in the solution, I talk about exercises for the bladder, pelvic floor exercises, protecting our bones, etc. But we'll talk about that. I know you've got a question later on how we can, so we'll do that, because it's very methodical the way you're doing it, because I can just go on and talk forever.
Thank you so much, Dr. Zoe. You're doing so great at answering the questions, and we are learning a lot today. So I'm having trouble sleeping and I'm always tired. Is this also due to menopause?
Absolutely, because the hormones are fluctuating, they're regulating, and that puts our body into flight and fight mode all the time. Our adrenaline is balancing. That's why it's important to balance the adrenaline. That's why we put on weight, because if you're not balanced in your adrenaline, your blood sugar levels are all over the place. And it's very difficult to control your insulin levels, and therefore weight is difficult to control.
Wow. Thank you so much again for answering that question. So now I know why I'm always tired.
You don't, you're glowing, but I know. But because you can only, I say to people, you can only compare yourself to how you were, which is what I do. And that's a question I always ask patients when they come in. The first question, how do you feel compared to 5 years ago? And it will tell you an awful lot about what's going on for them.
Wow. Next question. My memory is not as good as it used to be. Is this due to aging, or is this due to menopause?
Oh, menopause directly affects, because of the brain. That's why our nanos are extraordinary. They go right through the blood-brain barrier into the cerebral spinal fluid. But it's called, it reminds women of baby brain. They said, my brain never felt like this until I had a baby. You know, we get baby brain. And it really is. Because the hormones, that's why Alzheimer's is more higher risk of Alzheimer's after menopause. Very high, all medical studies have shown. So we have to protect our brain. We have to do lots of things with exercise, nurturing the brain. That's why those people do Sudoku, whatever it's called often. All these things help the brain, but I'll talk about some amazing products with, am I still letting people in, Princess Glory? Why not?
Let's be praying here.
Why not?
It's very late. Thank you so much. I'm having lots of headache lately. Is this due to menopause or constant headache at the back of my head, the forehead,
Menopause.
sometimes on the side? Is that all to do with menopause?
Not in, excuse me, not entirely, but certainly menopause, because what happens is it increases your blood pressure. And if your blood pressure is increased, what happens? You can get headaches. But the most important thing is a lot more consumption of water. And women, I'm not talking about coffee, I'm talking about pure water. And what we have found has been extraordinary is nanomagnesium extra strong. Nanomagnesium extra strong, nano zinc, and Okinawa for the bones. I'll talk about these, but phenomenal. They almost go overnight in the anxiety and you sleep better. It's the number one I go to for sleep. And also getting to sleep earlier. I say to women, I have a picture of a koala bear on a tree, and I say, this is what I want you to do. They say, you want me to go to Australia? I say, no, I want you to sleep more. So sleeping helps too, but definitely increasing water, stopping sugar immediately. Yes. And increasing your juicing. Intermittent fasting will help as well, but we'll talk about that as we go on. But that's all very important to do.
Thank you so much. Dr. Zoe, whilst you're talking about the product, you've said nano magnesium, zinc, and I couldn't pronounce the
Okinawa. No,
Okinawa.
You've said it beautifully. Okinawa is this magnificent, let me show everybody. I've got it here. Yeah. It is in Miron glass biophotonic. It's from Japan, where most people live to be over 100. It's a chelator. It has the highest form of calcium that goes through the body. You save these jars afterwards and you put herbs in them and they last 10 times longer. And it also has the perfect combination of calcium and magnesium. It has a little scoop inside. It's a beautiful white powder, and 3 scoops a day. It's incredible. It also helps the skin, it helps the hair, it helps you sleep. And people in Japan, we've written a great article, which I will send you to put on your website. I will send it to you for people to read. It also has 75 minerals, and it's a chelator, so it doesn't put any burden on the liver and the kidneys. I'm just letting someone in.
Oh,
I did it.
Thank you.
Great. Thank you, Jose. Thank you. I can't do both. I used to be able to multitask, but I can't do both. So this is it, and it's incredible. And it's the one thing that the Japanese government said after Fukushima, people to use to help with the effects of Fukushima. But I will send you the article to put on the website, but it's incredible. And for preventing osteoporosis, it is extraordinary for preventing osteoporosis. I urge women to try it. They talk about how much better they feel when they try it. Jose, can you add something? We love it. It's my go-to. It's even in a fire, it used to be the children first. I would rescue this. Probably the partner, right? But it's incredible. Exactly. I think.
So how many times a day can they take this?
I would take it. The wonderful thing about it, I will send you a sheet on how to take the nanos as well, if I haven't already, to put on your website.
Okay.
But what is amazing, you can mix it in water and drink it through the day. And I tend to use it with super greens. Let me grab the super greens with the phyto, and I'll send you some phytoplankton super greens. Is extraordinary for regulating your weight, everyone. So I would suggest, if you're in menopause, apart from cutting down on sugar, intermittent fasting. And could someone let Eileen in, please, and break it with the super greens and the Okinawa. And I'm telling you, it helps with the flushing and everything. I promise you. And this is made in Australia, 100% organic and pure. It contains all the omegas. But I must also say, for Princess Gloria, this does not have, it has a little bit of collagen. Our collagen diminishes exponentially when we go into menopause. I'm sure you have a wonderful collagen product that you sell, Princess Glory, and I suggest people buy it immediately, because collagen diminishes immediately. And you have collagen, don't you, on your website? You sell collagen, and I'm sure I've seen it. It's one of the best. I urge people immediately when they go into to start, even before in Peri, to start with the Okinawa super greens, collagen, the nano magnesium, and the nano zinc.
Cool.
And I will send an article, all these on your, to put on your website to support. I will, because they're all proven, and every single word in there has been proven scientifically. So I think this is important, very important.
Yes.
And I urge people to save the bottle, don't throw it away. It's Miron glass. Same with an nano, and if you put things in there, they last 10 times longer and they become oligodynamic. It's wonderful. Miron. I'll actually send you the link for Miron as well, Princess Glory, because they've done a great video. Jose, sorry.
Thank you.
We have a question here. Which of your products will address menopause?
Yes, it is the nano magnesium extra strong, the nano zinc, the Okinawa, and the super greens address it, and Princess Glory's collagen that she has on there. I can't remember which one it was, Princess Glory, but I remember it was a very good one. You can tell them after.
Yeah, I'll tell them. Yeah,
collagen there. Yeah. Collagen diminishes by 70% when you begin menopause, ladies. We must take collagen. It will ensure that the vagina isn't too dry. It will also help the calcium get into the bones. But remember, we must also increase our exercise. Weight-bearing exercises has been shown in medical studies. Even lifting, weight-bearing exercises preserves the bones. Yes, it's the best. A long walk and some weights. You don't have to do heavy weights, light weights. It's incredible for menopause.
Thank you so much, Dr. Zoe, for all these tips that you're sharing.
And also this book, Princess Glory, I was saying, this medical doctor has written this incredible book on menopause. I would ask women to buy it on Amazon or through you, Princess Glory, through your site.
Yeah, I'll put it on
your site is even better, then they know that it's good because you've put it on there.
Yeah.
And I would really urge you to put it on your site next to the collagen and the program that we could do together through Jose. For, you know, and I'm sure we'll offer a discount for people who've attended this. We can do something special for people who have come to this talk. Yes.
Yeah, definitely. Thank you so much. I'll definitely get the book.
This is phenomenal. It's like the Bible for women. It really is amazing. This lady she's done many, many years. She's the one that really helped Oprah, and Oprah promoted her. Yes.
Yes. Thank you very much, Dr. Zoe. Thank you so much, Dr. Zoe. Yeah.
No, Jose wants to
ask a question.
I have a question here, and perhaps this is from Marcia. Can you take those if you are on prescriptive drugs? Can you take those if you are on prescriptive?
Yes.
Okinawa super greens, collagen, etc.
The collagen you certainly can. If you are on heart medication, my love, I'm not sure what you are on, and I don't want you to expose yourself. You can always email afterwards privately through Princess Gloria. But if you are on heart medication, you must take nano magnesium separate. And I say first thing in the morning. The nanos, here, I will grab the nano magnesium. The nanos must be taken only in glass. I will provide a sheet for Princess Glory who will issue this. They go through all the soft tissue in the mouth, the oral mucosa. They go right through the blood-brain barrier, triggering the hormones into the cerebral spinal fluid, and then immediately there's a portal for the nervous system, and everything is accessed through that. We have a magnificent chiropractor, Pearl Walter, who will, I'm sure, will tell us about that. Pearl, if you could unmute yourself for a moment, please. No, that's okay. Pearl?
Yes.
You, about the back, it's got every nerve, hasn't it, for every part of the body?
Yes.
Yes.
It's important to keep, yes, it is. Yes. And it's important, as you mentioned, for the cerebral spinal fluid, which is like it can be regarded as the life force.
Yes, phenomenal. Thank you, Pearl. Thank you. Pearl doesn't mind. Pearl doesn't mind. But that's how you take them, and you can mix them together. But I will provide a sheet, Princess Glory, because it's very important that these are taken properly. And this glass is amazing. And do not think that these are expensive. As I said in my last talk, you don't know what supplements do. They have to go through the liver, the kidney, and the stomach. This bypasses all that immediately. So you're getting it 100% elemental with no side effects. Yes. So that's important to mention at this point.
Thank you so much, Dr. Zoe. All these products, you can get them on our website. We'll obviously share the link at the end. If anyone has joined us for the first time, and we can speak to you after the program and we'll tell you how you can get the products. They're all on our websites. Thank you, Dr. Zoe. I'll ask the next question.
Yes, of
I'm
course.
so excited with all the information that you're sharing.
And I think you provide elixir collagen, which is phenomenal. I urge all women before and after. It also will help. Now, and also, I know you do a great vitamin D. We do a mycel D. It doesn't matter. A great vitamin D is very important for the bones for women. It is a hormone. It is not a vitamin. It is a hormone, but very important for menopause. I say 2,000 international units a day. I know you've got a great vitamin D on your website. With collagen, I'm not sure with the elixir one how much to take, but I know, Princess Glory, you will advise them accordingly, because I'm not familiar. I'm familiar it's good, but I don't remember the dosage of it.
Okay, they can take it twice a day. They can take one tablespoon twice a day.
That's because that will ensure that the calcium and magnesium will get to the bones, to the right areas, and not sit in the organs causing problems. That is important.
Thank you so much, Dr. Zoe, for answering all these questions. Wow, we've had a good time today just listening, and you're answering all the questions. The next question is, does menopause cause moodiness and depression? Yes, it can. It can. And if you consume vast amounts of sugar, it makes everything worse. I would really suggest when a woman, may I also add, during menopause, especially a woman who is over 48 years of age, medical studies have shown that her stomach acid will diminish by 52%. When your hydrochloric acid, stomach acid diminishes, you cannot assimilate calcium, magnesium, and other nutrients in your stomach. So it is extremely important not to overburden your stomach, and to also include a good probiotic, which I also know you have, Princess Glory. Yeah, we have a to address the stomach, but also to do intermittent fasting. That's why these are fantastic, because they bypass the stomach. They go through the blood-brain barrier immediately into these nanos, immediately into the cerebral spinal fluid. But I would also suggest, and that's something that Eran could help, and I'm sure I would suggest fasting, juice fasting. If your body's overburdened and you're beginning to get into hot flushes, don't start filling it full of food. Stop food, even for a day, and take some lovely juices. Or just have light meals, yes? Because it's showing you that your body is in an inflammatory state. Your body cannot cope. Can I ask you a question, Dr. Zoe? We're about to go on a 10-day fast in October. So can I fast for those 10 days on water and just take the minerals and nothing else? Will I be okay, or do I have to? You will be okay. That would be absolutely brilliant. That we will be, and I know that you will have prepared beautifully before. I did water. Actually, Pearl did water for 6 weeks, I think, once. What? Bless her. Yeah, Pearl. Didn't you, Pearl? 25 days. 25 days, I'm sorry, but you prepared before and after, sorry. Yeah, 25 days, amazing. Yes.
Pearl fasted. It was an extraordinary experience. I fasted for 2 weeks on water, but fasted on juices thing for longer. But it is a wonderful thing.
So I can take the minerals every day, because at the moment I'm taking gold,
yes,
magnesium, I'm taking zinc and copper and the silver.
And how are you feeling?
Feeling great, actually, since I started taking the indium, because
Yes.
Jose told me about it. They said I was
Yes,
for hormonal
yes.
issues. I have found that I've been sleeping well, because even when I don't go to bed on time, as soon as I tell myself I'm going to sleep, I am sleeping.
That is
So
fantastic.
indium is definitely good. It's expensive,
incredible.
but it's very good.
Here is indium. It's tiny, it's precious, it's special, amazing chelator. A lot of actresses and famous people take it because it keeps them young.
Mhm.
And you must take it separate to all the others, a couple of drops. That's correct, Jose?
Yes.
Yeah, you said 1 drop, but Jose,
One
I'm
drop,
taking 3
yes.
drops. I'm thinking,
1
am I
drop.
overdosing?
Yeah, no, I did 3 when sometimes I take 3, it just depends how I feel, but I'd always take 1 a day, but it's incredible. It's precious, absolutely precious. But I must send you the sheet so you can put on how to take them, and they must be put in a glass vessel. But talk about depression, nano gold, nano platinum with nano magnesium must always be taken with nano magnesium, because nano magnesium is the precursor. But nano gold, especially if you've had long COVID and brain fog, is fantastic. Especially medical studies have shown that nano gold, and it wasn't like ours. Our nano gold is below 10, so it goes right through the blood-brain barrier, showed to help with Alzheimer's, Parkinson, and multiple sclerosis, and for depression, because what it does is it increases dopamine in the brain.
Wow.
It's fantastic.
I have been taking the gold, trust me.
It's amazing. So if
Every
a woman,
day.
I urge a woman, if she's going into menopause and she feels depressed, to treat herself to nano gold. And to start, nano gold needs to build up in the body. You start with 5 milligrams, then after a week you go to 10, then you go to 15, then you build up to 20. So the bottle will last you a long time. But nanomagnesium, you can start with 30 milligrams and you can take 20 milligrams in the evening to help sleep. But with the Okinawa, you'll sleep like a baby. I'm so glad that it's all helping you. That's fantastic. That's fantastic.
Yes, we have a question.
Yeah, no, because
I don't know if you can see it, Princess.
I
Yes.
can't see anything, so I leave it to you and Jose.
Oh, yeah, I can see it. Corbett is asking, I'm 65 years and I started menopause in late 40s. However, since having COVID March this year, I've been having hot flushes every day.
Yes.
And now I'm having high blood pressure. Do you think COVID is the cause?
Well, COVID hasn't helped, because what COVID does is it weakens the immune system and puts our body in a permanent inflammatory state. I must say, you need to go on juices to lower your blood pressure, especially celery juice. I'm sure Dr. Erin will tell us, but it's phenomenal, and beetroot juice. But you must stop sugar, and I tell you what will really help is nano magnesium is incredible for lowering blood pressure. Also, nano zinc and copper is incredible. I don't know what your iron levels are, but also nano gold will really help you tremendously. And I would recommend super greens because of all the omegas, super greens and some collagen. And don't forget the vitamin D. I urge everyone to have their vitamin D and immediately take vitamin D every day. It is phenomenal. Yes. And I know you do a great vitamin D. We do a mycelated vitamin D, but you do a great vitamin D online, Princess Glory.
Thank you so much. Somebody else is asking a question, Marcia. She's saying, please, is there anything for stroke? Somebody that's had a stroke and they're age 51.
Oh, yes. Amazing. Nano magnesium and nano gold is incredible. We've had amazing results with people who have had strokes. It's odorless, colorless as well, and it won't interfere with anything. It's fantastic, fantastic if you've had a stroke. And also some Okinawa, because it's got calcium and magnesium to recalibrate the heart.
Mm-hmm.
Yes.
Thank you so much. We've got the nano gold on our website. You can buy the big bottle. I think it's 55 for the big bottle, the one that Dr. is displaying. The nano magnesium, we've got that as well. We've got the nano zinc and copper, nano gold, and all the ones that she's mentioned. They are all on our website.
Fantastic.
Thank you so much, Dr. Zoe. I'm still going through my questions.
Doesn't matter.
But
They're
please
beautiful.
continue to put your questions on the chat. We will answer them.
Yes, Jose and Princess Gloria are seeing them, everyone. I can't see them, but
no, it's okay. It's okay. I'll
Princess Gloria and Jose will make sure I hear them.
How can I counteract vaginal dryness during menopause?
Well, let me tell you, the first thing is increase your water levels. Increase your water levels. And please change your attitude to your body and love it. Yes, because a lot of women don't. And the other thing that's very important is to use natural lubricants, jojoba oil, coconut oil, all these natural lubricants. I have a list here that I used to give to women. Let me read it for you all. And I used to use these all the time, but I would really suggest, there are other things I can suggest, but it might not be, because vaginal atrophy is a very prominent condition during menopause. But I would also suggest pelvic floor, and I also want to say, don't over clean the vagina. The vagina is self-cleaning. If you are healthy, men, I'm sorry, I have to say it, we're adults here, we have to talk about it. The vagina is a self-cleaning, extraordinary organ. Yes. And I would also suggest for vaginal dryness that you insert a probiotic in there, coated in some coconut oil. And I have found this incredible to help women. Incredible. Yes. And don't use perfumes or any of those cleansing. Get a very good organic. I'm sure you sell one, Princess Glory, to clean that area. A good organic one, non-scented. This will really help. Hello, Erin. Hello. Hello.
Hey, Dr. Zoe.
Hi.
How you
Hi. I
doing?
know that you're the juice, and I know you can, but is it true that celery juice is very good for lowering blood pressure, and beetroot juice?
Yes.
Yes, both of them are phenomenal
Yes.
products for lowering blood pressure. The celery mainly because it's so rich in potassium.
Yes.
And
yes.
the beetroot juice is also very high in nitric oxide, which really helps to widen the blood vessels. So it really helps to take the pressure off the heart, to not have to, beat so hard and push so hard to get the blood through the arteries and through the pathways. So beetroot is very, very good. There's been lots of studies that have shown them people have used beetroot. It's increased their stamina, it's increased their oxygen capacity, it's increased their ability to do exercise by at least 15% just from using beetroot juice alone. So beetroot juice is exceptionally good for just building the blood in general and lowering blood pressure. But the celery juice is phenomenal, not only for the blood, but also for the gut, because of the potassium content in it. It really supports the function of the muscles and the stomach muscles for good peristalsis, to remove the waste and take the pressure off the digestive system as a whole. So yes, celery juice is a fantastic
fantastic and organic, of course, and
absolutely organic.
I used to love it. And also I would recommend that people break their intermittent fast with a juice first, because we mustn't, to help with menopause, don't put pressure on your stomachs.
Absolutely.
I say take pressure off. So because while the body's trying to digest food, it can't heal. It won't heal. Thank you so much. I thought it was. I used to give, and I know the super greens help lower, but the best thing for lowering blood pressure as well is using other mind awareness as well, and other aspects, and also looking at your cholesterol levels, and looking at what your cholesterol levels are, which again, the juices will help tremendously.
Absolutely. We always find people that have high blood pressure that always have a high level of stress. As a precursor, before the blood pressure comes, before the cortisol levels go up, the adrenals become completely
for a
stressed.
long period of time too, Dr. Erin, a long period of time as well. They've had this stress.
Yes, and that's always the biggest cause, before any of the other physiological factors come in. The psychological, the emotional, that is are the first underlying triggers that trigger all those other biochemical processes in the body that cause the cortisol levels to rise, adrenal levels to rise. And when the threat that they were, the threat that they were addressing has gone, they remain in that heightened state of awareness, and adrenals don't go down, and that's when they start moving into problems.
And the cortisol levels, elevated cortisol levels, everybody, is very important, because that's often people put on weight And it's because of elevated cortisol levels. And until they address them, they cannot actually lose the weight. And it's a terrible problem during menopause. Yes, wonderful.
Thank you so much,
Glory,
Dr.
your
Zoe.
next question.
Next question is
Wonderful.
from Bernadette, and she says, I'm pre-menopause and I want to get healthy and I'm having my body functioning at its best. I'm currently breastfeeding. Can I take
Yes.
the item's advice? Is it
Yes.
safe to take these products while breastfeeding?
Amazing to take them, especially the Okinawa and especially the zinc and copper, because you need extra copper in the 3rd trimester of pregnancy and when you're breastfeeding, and nanomagnesium. And everybody, may I just say, zinc and copper. Copper increases the blood cells, opens them up, so you're bringing more oxygen in, and copper is diminished when you're breastfeeding. So I can really recommend it. And the Okinawa or the calcium, it's going to be an amazing baby.
Oh, thank you so much,
It's
Dr.
going to be an
Zoe.
amazing baby.
Enid is asking a question. Can I take 30 ml magnesium in the morning and 20 in the evening?
Yes, you can. It'll really help you sleep. I suggest you start with 30 magnesium. Don't overkill. Start with 30. I don't want you wasting your, and then see how you go. And if you haven't slept and it hasn't done enough, then take the extra 20 in the evening. But do start with 30 and see how it goes.
Cool. Thank you so much, Dr. Zoe, for that question and for the answer to that question. Hold on 1 second. Okay, next question. Ever since my period stopped, my desire for sex has decreased. Is this normal if I'm in menopause or pre-menopause?
Yes, it is. There's always other factors involved as well, and what has happened to the woman, etc. But this is quite normal. And the way to gain this back is many ways, but I have to say often it's what goes on in the mind, and taking really good, looking after yourself, really good juices, eating really well, nanomagnesium, nano gold, Okinawa, and the super greens with all those omegas will help the lubrication well. And of course, we must look at the D levels. The vitamin D levels are very important, because women with low vitamin D levels have a very, very low libido. It's been shown over and over again. Yes. And also the collagen, that wonderful silica, the collagen is important for elevating. And I could talk more deeply about it, but it may not be the appropriate place. But maybe we should do a private one once with women that want to talk about these things. I think is very important, because there's many things that women can do on levels to help increase that. But it's another conversation probably.
Okay, cool. Thank you so much, Dr. Zoe. I had so many questions to ask you and we run out of time. So
you can ask one more if you want, Princess Glory. Do ask if people, I don't have to.
The one question I want to ask is, does menopause cause urine leakage?
It can do, it can do. And also menopause, it can do. That's why I say pelvic floor exercises, and also how you've addressed the stomach. If you have a lot of putrefaction in your stomach, it will put extra pressure on your urinary system as a woman. So I really urge, I mean, when I went through mine, I didn't have any symptoms hardly at all, because I juiced and all these wonderful things. And I really urge women to empty their gut. And I know that you and Dr. Erin can help with that. Juices are amazing to prepare you for that. And I always say to women, do a juice 2 days a week or 1 day a week, or start at 4 o'clock and go till 4 o'clock the next day. That's just like fasting as well. But consume, and remember, consume vast amounts of water. And I know they say, oh, but I'm peeing all the time. Eventually you'll be peeing less.
Mm-hmm.
Yes, if I can add something, Dr. Zoe, there.
Yes.
Actually, one of the things that happens is as the hormones change, especially progesterone, then you start a drooping of the organs, because you also lose collagen. And if you have a double factor, which is if you don't exercise and you have loss of collagen, then the ligaments that hold in place all the organs start becoming laxer and laxer, and the organs start to droop. So it's so important that you eat the right food and like juicing, for example, do the intermittent fasting, but also that you consume the collagen and you take the minerals, because the minerals are the basis for all the hormones to be produced. You know this, but most people don't know this, because vitamins have been the ones that have been on the stage for many, many years, because that's been the strategy of the pharmaceutical companies. But in reality, the basics of it is the minerals. If you have good mineral absorption, then you have your body, you give your body the ability to produce all the hormones that are needed. And this is very important at this stage. Yeah.
Very, very important. Thank you, Jose, very much. And Princess Glory, I'm wondering, the first talk we did, people wrote to me and said, if we could maybe, can people access it again?
I can share it. I can share it too.
With the minerals and things, which is very important. And the other thing is, people must, Jose has a valid point. We are ionic minerals. The whole earth is made up of a, and when you consume these and get these right, including not just in the nano minerals, in your diet and how, and juicing and good foods, good fresh fruits and vegetables, etc., is the most, you bring vitality. Live food contains structured water and brings vitality to the organs and brings vitality to the person. And with that, you can do anything because you have resources to pull on, and illness disappears because chronic inflammation diminishes in the body. Yes. It's all about lowering inflammation. So this is important. If nobody takes anything back, if they can please understand that point, it's so important because it's the basis of all good health.
Just to say, when before you close, I know somebody was asking about taking the minerals while they're pregnant, and someone was asking also about the elixir of life. The elixir of life is actually a product that's very rich in silica. It actually comes from the rainforest in Peru, so it's full of minerals because it comes from the soil. It's very rich in silica, and silica is the precursor for collagen. So the body uses silica to produce collagen along with elastin. So when you have elixir of life in your body, the body will use that to produce collagen that will actually start to support your skin cells, the development. It will start to support your bone structure. It will help to support your joints. It will help to support your hair because your hair is very reliant on collagen. So hair starts to regrow as a result of you having the extra silica in your body and that extra raw material for the collagen production. So people always talk about having extra hair growth, but it also contains negative ions as well. If you know anything about negative ions really helps to change the polarity of your low vibrational frequencies such as bacteria and viruses in the body. So the silica in Elixir of Life is very effective. And the second product that people are asking about was the Menovate Balance, which is essential oils that really helps to bring the endocrine system into homeostasis. So the hypothalamus, the pineal gland, the pituitary gland, they all come into alignment. And as a result of that, you feel really calm during the day. You feel more centered, more relaxed. At nighttime, you sleep exceptionally well. But the byproduct of that process of the complete balancing is that hot flushes literally diminish. And we've seen it happen often within 7 days. So Menovate Balance is a very effective product at really helping women that are going through the menopause to really bring their body back into harmony and into balance. So those are two products that people mentioned, and you can use both of them while you are pregnant because they are all plants and they're all from the soil with no adverse effects.
And thank you. And I mean, I don't know about this, but I know, but I also want to say the most extraordinary product to use while pregnant, especially in the 3rd trimester, is Nano Iron.
Definitely. Because
you have absolutely no side effects whatsoever. And I give it all the time to my patients. And it really is extraordinary. I'm hoping one day it'll be given readily in the NHS, but for now, I really can't recommend enough Nano Iron for the.
And you don't get the constipation with it as well. You don't get the constipation with the other type of iron.
Nothing, all the stools or any of the problems in the gut where you have I don't like the term bad bacteria and good bacteria, but it's been coined and people understand it. We know that it's a misnomer, but let's leave it at that for now. The fact is, if you don't take proper iron supplements, it will increase the bad bacteria and it will decrease the good bacteria. So that's also important. The nano iron is an incredible product. We can't get enough of it to our ladies. So men use it as well, but I cannot urge enough if you're pregnant. And you can take up to 60 to 90 milligrams in the 3rd trimester. So that is extraordinary as well. So
now, can I ask Dr. Zoe, if you're going through menopause or in pre-menopause and you're feeling very tired, I think that was one of the questions I asked you. So can we take iron in the morning or take it morning and evening?
I would take iron on an empty stomach in the morning and a little bit in the evening. But what I would do, because when you're going into menopause, if you've got an iron problem to begin with, I would address everything really well. And then I would start with 30 milligrams of iron only once a day, because I tell you, when you take the Okinawa and everything else, it will regulate. And if you're still tired, then you will know how much iron you need to take. But people need to address it. It's multifactorial, because we're colorful, magnificent human beings with energy that goes from here to the universe, aren't we, everybody? That's what we are. We're extraordinary. So it isn't just, and as we know, we're each as unique as a snowflake. But
and is it Okinawa that? Is it the Okinawa? So is it the Okinawa that chelates the heavy metals?
It is extraordinary.
Yes, because I find that people often who are having problems with their iron absorption or being anemic, it's because their bodies are absorbing the lead and the other heavy metals first. So sometimes when you have an iron deficiency, it's always good to look at use other interventions like Okinawa.
It's fantastic. And our chlorella. And our chlorella, because it's chelated chlorella, and it's
fermented.
Amazing. And it's not grown in China. I've talked about it. It's incredible for chelating. Yeah, very good. So now I think one more question. I think we're going.
Thank you very much.
Sorry.
No, don't go.
No, I don't want to.
Don't go. I think, Dr. Zoe, we're going to have to bring you back for a part 2. Because
no, whenever. Jose and I are always honored to come here. Yes.
Less than half of my questions were answered, and I can see so many people logged on this evening, and I'm sure they want to hear more and they want more questions answered. So thank you so much, Dr. Zoe. You've talked about osteoporosis, it's affecting us. You talked about the eyes being affected by menopause, glaucoma, and cataract has been affected. And you also talked about
Alzheimer's.
Yeah, that's the one, Alzheimer's. So please, Dr. Zoe told us about having exercise, good exercise and stuff. So the last and final question I just wanted to ask is that as I mature past menopause, how can I achieve the best possible health?
Yes, how you can achieve it is firstly with the diet, really, really addressing your diet. And I would recommend you Princess, I mean, need me to advertise, but absolutely removing everything that's artificial in the diet, especially sugar. And then I would look at really good water and everything we've said today. And people, if next time we're going to start right on time, people come early, then we've got more time for everybody. But I would really look at that. It's the number, everything stems from that, and you have something for the rest of your life. And while we've still got good food on the planet, while it's still available to us, none of us know what the future is. I'm not being doom and gloom, but we need to use it as medicine, and it's the first port of call, and everything else stands on the shoulders of a phenomenal diet and brings you to another portal of great health, because that's what these do. They really are, bring you to human potential of good health. And the more good health we have, the more we can cope with everything, honestly.
Okay, so Dr. Zoe, if there's 5 products, nano products that I should take every day, which 5 would I take?
Well, I would, sorry.
At the moment, I take gold.
Yes.
I take platinum.
Yes.
And I'm just beginning to take the indium. I also take zinc and copper, and I have been taking the other one you mentioned, magnesium. So if I just wanted to just take a few, which ones should I take every day?
Nano magnesium must always be taken because it's the precursor for all the others. Mm-hmm. Are you saying if you just needed to take a few?
Yeah, because I'm asking on behalf of my clients, but I take it as a routine anyway for me personally.
Absolutely.
But just asking on behalf of some people, because obviously, you know, you've showed them the bottle, we've got them on our website.
Yes.
But, you know, some people might say, you know, what 3 should I take or what 5 should I take? So
absolutely,
that's the
absolutely.
question.
I would start with the nano magnesium, Jose, or the nano magnesium for a woman. This is obviously a woman, and we're talking about menopause. So I would take the nano magnesium, I would take the Okinawa, and I would take the super greens.
Okay.
And amazing. If you can, the nano zinc as well, or the nano zinc and copper. But if you can, that would be amazing. And of course, for the depression in the brain, if you can't take the super greens and you can do phenomenal other things reducing, I would take the nano gold, because you will feel amazing on it. It'll really help with the depression and give you strength. And when you help with depression, you can do more positive things in your life, much more. And you're more likely to look at other positive things and surround yourself with more positive people.
Definitely. Definitely. Just thank you so much,
thank you
for tonight. And thank you, Dr. Zoe, for coming. We appreciate you. If anyone would like further information about this, I put my number on the chat. You can contact me. For the people that have logged on from the US, we will definitely be speaking to you. I've put my number there as well. You can WhatsApp me and I'll send you all the information you need. We do post products to the USA as well, so you can contact us and we would get the product to you as well. Thank you so much once again, Dr. Zoe, for joining us, and thank you, Jose, for joining us. Thank you, Juice Doctor, for joining us as well.
Yes, thank you. Yes,
and for putting in your comments. And thank you, Pearl, for joining us and answering our questions. Pearl, I definitely would like to connect with you so that you can come on our show as well. And we're here every Thursday. For those people that are joining us for the first time, we're here every Thursday talking about different topics, different health questions, answering your questions, and giving you more information about how you can manage any health situations you have. And we've done a few topics. So if you wanted to find our previous videos, they're all on YouTube. And the YouTube channel is Glory Edward Nutrition. So if you type it on YouTube, you'll find all our videos we've done about food and the other things. But we'll definitely be bringing Dr. Zoe back and Jose back to do a topic on long COVID, and also to do the part 2 of the menopause, because I think is a topic that a lot of people need to know about. And thank you once again for joining us.
Thank you.
We appreciate you. And for everybody else that has joined us this evening,
thank you.
We are grateful.
Thank you to everyone.
Thank you very much. Have a lovely evening, everyone. And see you again next week, Thursday. Remember, next week, Thursday.
Thank you, everyone.
Thank you.
Thank you, Princess Glory, for what you do.
Thank you, Jose.
What you do to help and empower people. There isn't anything more powerful than that on this planet.
Thank you. So much. Thank you very much. Thank you so much, everyone. Thank you.